Hi everyone, and welcome to my lesson. I'm Catherine. I'm a designer specializing in visual communication and design research. I'd like to ask the question, how can design and research work together to tackle the pressing issues of our time? Today's lesson will cover how the popular concept of design thinking can be applied to a challenging issue. So what is design thinking? Design thinking is a solution-oriented process that involves understanding the end user and solving the challenges they are facing. There are 5 stages to the design thinking process. These 5 stages are called empathizing, defining, ideating, prototyping, and testing. In this lesson, we are going to apply the design thinking process to a particular challenge in the healthcare sector. We're going to use this method to tackle challenges in mental health. Can we use design thinking to support mental health recovery? Let's try it and see. In design, what does it mean to empathize? Empathizing is the first step of the design thinking process. It involves exploring the theme or topic at hand and gaining a deep understanding of the end user in terms of their needs and the challenges they are facing. So in terms of applying this step to a mental health challenge, how may we do that? We can look at 1, trends that mental health organizations and communities have reported, and 2, personal stories from people with mental health conditions. We can ask the question, what are some of the problems people with lived experience of mental illness are facing? During this phase, the aim is not to make decisions based on our own implicit biases. During this phase, we might use different tools such as interviews and focus groups, and use our observation skills so that we can better understand the needs of our end user. Stage 2 in the design thinking process involves defining the problem. This process in the design thinking methodology involves establishing a clear idea of which problem you will solve. This is where you establish a problem statement. A problem statement defines a challenge that the end user is facing. So, as an example, perhaps we have discovered that the end goal of any illness is recovery. In that case, how do we support people with mental health conditions and help them recover? The problem statement might look like this. People with mental health conditions often feel isolated because they are afraid they will experience stigma if they reach out to people. Being able to connect with people in a non-judgmental environment helps establish good coping skills and also leads to mental health recovery. Ideation is the third step in the design thinking process and is where you begin generating and working through your ideas. This is where you allow your findings from the previous 2 phases to inform your ideas, but it's also where you can really play with your imagination. There are many different ways you can ideate. You can create mind maps. You can storyboard your ideas. You can brainstorm with a team of people. My favorite techniques involve sketching, drawing rough diagrams of my ideas, and exploring my thoughts in that way. So going back to design for mental health, if the goal is to provide the opportunity for mental health recovery, what are some design solutions that we can come up with? Maybe we found out through our research and preliminary observations that factors leading to mental health recovery include having the right social and emotional support. So we can perhaps write down keywords like community, friendships, kindness, family, connection, and inclusion. We can then begin to sketch out our ideas. Maybe you would like to create an app that encourages unconditional acceptance. Maybe it's a service design project for mental health staff that prevents burnout so they can better support their clients. The 4th phase of the design thinking process is called prototyping. Prototyping is when you really start to decide what form you would like your design solution to take. Is it an app? Is it a physical product? Is it a social media campaign? Here you begin to think about factors such as what your end user needs and how they would interact with your design. In this phase, you begin to prototype scaled-down versions of what you'd like your final product to be. These low-fidelity prototypes are not expensive to build. This way, you are able to fail repeatedly and reiterate as many times as you need. Perhaps we've decided to make a card game that allows people to open up and be vulnerable, therefore allowing them to make meaningful connections with other players. We can start to jot down some kind of structure or game mechanics. We can start to include words on the cards such as instructions or prompts. We can sketch out rough visuals. You can sketch all of this out using pen and paper. It's in this phase that you can bring your ideas to life in a cost-effective way. Testing is the final step in the design thinking process. This is where you start to gather user feedback. During this phase, it's important that we test our design with the right people, so that we may be able to accurately gauge the usefulness of our solution. In this instance, we would want to let people with mental health conditions test out our card game. We can ask questions that we feel will help us better understand their interaction with it. Questions such as how the card game impacts them, how they play the card game, and what sort of challenges they are facing while they're playing. The testing phase involves constant reiteration and adaptation, all based on user feedback and their observations of what is working and what isn't. So there you have it. We have learned what the design thinking methodology is and how to apply it to a particular challenge that impacts the well-being of many people. We have learned the 5 steps that make up this process: empathize, define, ideate, prototype, and test. How will you use design thinking to make an impact? The possibilities are endless. Thank you so much for watching. I hope you enjoyed this course and that you